Hi everyone, Gary Bronze here, back to welcome you to the fifth episode in our series on kidney disease. We have one more to go after this. Today, Dory, Melissa, and Jane are talking home dialysis. As always, I'd like to welcome any newcomers to the series, and I'll let you know that the purpose of this presentation is for you to be able to ask questions of these clinicians. So you can do that by using either the chat feature on Zoom, or you can simply unmute yourself and we'll do our best to answer all the questions. I would like to ask if you can wait just until after the presentation is finished before we take the questions. So let's get started here. Jane, I'm going to ask you to lead off, and let me pull the slides up. Okay, here we go. This is us. Jane, why don't you start off by telling us what home dialysis is?
Okay. For those of you that I haven't met, my name is Jane Davis. I'm a nurse practitioner at the University of Alabama at Birmingham. And I know in the past I have sounded like I think UAB is the best program in the world, and I'm sorry, I think it is excellent, although I think we all come from very good programs, and I'm hoping that the program you're in is equally as good. There is a food chain in the South, I think it's mainly in the South, called Chewy's. And they have a big sign in there that says, when you've seen one Chewy's, you've seen one Chewy's. And that's the same way with many of the dialysis kidney programs. There are some commonalities, but we are all different. Now, when I teach classes, I usually start off by asking the people who are there to name the type of ice cream they would order if we were in an ice cream store and they had no restrictions. The reason I do this is that it kind of drives home that people don't always agree. Not everybody picks butter pecan, not everybody picks vanilla. Most people will pick something different. If I have 8 people in a class, I get at least 6 different flavors. And that's the same way with dialysis. So what we've done in the previous 4 sessions is we've talked about what kidney disease is, how it impacts your life, and some of the things you can do to slow the progression. But for many people, there comes a time when it's no longer a what if or when, it is a now. And this is when you have to really make a very difficult decision of what type of dialysis am I going to do. Now, in this journey, many people will try several types of dialysis. They may have a transplant, they may dialyze in center, they may dialyze at home. So we're going to start today with home dialysis. Next slide, please. So there's no place like home. Home is where the heart is. I find that with my patients, they often are afraid to dialyze at home. They're afraid something can happen. I just want to assure you that if you are going to be treating at home, you will be taught, you will be reviewed. Those nurses will not cut you loose until they're sure you can do it and do it right. Plus, you have someone on call 24/7. You're not just thrown out into the woods. So what is home dialysis? It can be, as the lady is sitting in the chair, it can be what we call peritoneal dialysis, or with the gentleman, it can be hemodialysis. The hemodialysis machine looks very different from what you see if you dialyzed in center, which we'll talk about next week. But many people prefer home dialysis because they can do it at home on their own schedule. And for many people, they can do this alone without any help. Now, I think universally, people who are on peritoneal, or PD, do not have to have a partner. Home hemodialysis, the regulations vary from center to center. Some centers say you have to have a partner, some do not. You do receive extensive training for whichever one you are going to do. Next slide. So when you dialyze at home, the treatment adjusts to your schedule, not you to the schedule. When you are coming in to an outpatient unit, is that dog bothering anybody? His barking?
No, but just let him know he's not getting paid.
Okay. I'm sorry, I don't know. I thought he was somewhere else. So the treatment adjusts to your schedule, not you to the treatment, which means if you prefer to dialyze at 2 o'clock in the morning, as long as you do it, consistently, that's fine. I had a patient who was an emergency room physician, and his wife helped him with his dialysis, and he worked night shifts, so he would come home 7, 8 o'clock in the morning, and she would start his dialysis, and he would sleep while he was getting treatment. For most people, the dialysis is later in the afternoon or at night, but it's an individual preference. People who dialyze at home still can partake in family activities. I had a student whose father had been on home dialysis, and he thought it was the most natural thing in the world to eat supper and everybody sit around and watching TV while the father dialyzed. He thought everybody did that. Another advantage is weather and transportation are not issues. So if it snows, if it's raining real hard, or here in the South, we have hurricanes or tornadoes, you don't have to worry about it because you are at home and you don't have to worry about getting out into the elements. I think one of the most important things about home dialysis is the independence that it offers. You're in control. Now, I know I myself really hate anybody telling me what to do and when to do it. I like to be in control. And some people prefer to turn that control over to someone else, and that's fine. But if you want to really maintain control, you may want to consider home dialysis. I think for many patients, when we talk about dialyzing at home, they are very afraid. And your nurses who train you understand this, and they walk you through your fears, and they're very supportive. Another point about home dialysis is that it's very portable. And I say kind of portable because while I can lift the peritoneal dialysis machine, I cannot lift the hemodialysis machine. Yet I know that there used to be an ad which showed a woman at the beach sitting on the balcony of her hotel with her dialysis machine. Be that as it may, you can move them around if you have to. Next slide. When we talk about peritoneal dialysis, as I said, or home dialysis, we generally are thinking of peritoneal, although there are good number of people who do the hemodialysis at home. Peritoneal is very portable. It makes vacations and travel easier. As with any dialysis, it requires surgery for a catheter placement. And anytime we talk about a catheter in medicine, we are talking about a hollow tube. There is a hollow tube that is placed to the side of your belly button. There are no needles with peritoneal dialysis, and no blood is outside the body. The good news is that it's done every day, so your blood is cleaned every day. And as you'll learn later, your diet is much less restrictive because your blood's cleaned every day. The bad news is there's no day off. So in peritoneal, your body provides the filter. It can be 4 times a day at night with a machine, or a combination. If you do it 4 times a day, it's by gravity. Everyone learns to do it by gravity for traveling or in case your power goes off. There is a lot to peritoneal that is confusing, and I know there are a lot of questions. And actually, when I teach my class, I probably spend 20 minutes on peritoneal. Gary, could you flash back to me so I can show a PD catheter, please? I'm not seeing me. Okay. Can y'all see this? This is a PD catheter. This is what we put in. These right here are cuffs, and they are underneath your skin. So basically, and this is a pigtail. Not every program uses a pigtail, but we do. And what happens is the catheter is put in, your skin grows around these cuffs and secures it, and this is kind of tacked usually to your bladder. I know it doesn't show here, but there are little bitty holes in there. That's called fenestration, and that allows fluid to come out from the bags into your peritoneum, and that is when it acts like a sponge picking up the impurities. This part is outside the body. This is a cap. And when you're going to do what we call an exchange, you hook up to a line. I'll show you a picture of it. And you unlock. You take dirty fluid out. You put clean fluid in. You lock it up. You put on a cap, and the cap has a betadine sponge, and you are good to go. Now, different programs use different models, but this is pretty much it. Okay, I can go back to the slides. When you choose to do peritoneal, you do need space for your supplies. They will be delivered to you either every 2 weeks or every 4 weeks. If you don't have a lot of space, remember that if you get a new shipment, you will be using them every day. Generally, you have 1 clinic visit a month. We discourage tub baths, swimming in rivers and lakes and ponds because they're not always the cleanest. Diabetes can be a little harder to control, and training takes about a week. I don't know if you can focus in on this top slide. I like it, except it doesn't show a drain bag. But basically, what it is your peritoneum, or which we call the gut, is a cavity about from the bottom of your diaphragm to the top of your bladder, roughly. And it includes all your intestines, your spleen, your liver, your pancreas, your gallbladder, and your appendix. And all the blood in your body is constantly going through there. So you can see in that insert there is the blood, and those little dots are waste particles. And the dialysis fluid goes into the peritoneum. It stays there. That's called a dwell. And it soaks up extra fluid that you may have been drinking. It soaks up impurities, and it helps balance your electrolytes. These are all things that your kidney would normally be doing. The bottom insert shows someone doing a manual exchange. You don't have to have an IV pole. You can use a coat hanger over a doorknob if you want. But you see a fill bag and a drain bag. So what that patient has done is he is hooked up. Takes about 30 minutes. You usually do this 4 times a day. That's the manual. The other alternative is to do it at night with a machine. Next slide, please. So home dialysis is a great option for people who want it. If you don't want it, that's fine. If you do want it, that's fine. We help you either way. I'm sure you will have a lot of questions. Hopefully you will have more questions at the end of the program. Just write them down so you don't forget, and now you can take me off of video. Thank you.
Thank you, Jane. So I'm going to talk a little bit about what is associated with choosing home dialysis. And so there's a number of issues to consider when you're deciding on a type of dialysis, including where to receive your treatment. It's an important consideration that should be made between you, your family, and your healthcare team. You can do dialysis at a center with a nurse, technician, or other member of a healthcare team that performs the tasks required during the treatment, which we'll talk more about next week. You can also do dialysis at home where you are the one in control of your treatments. People who do dialysis at home have more flexibility about how often it can be done. For home hemo, if it's done daily, treatment time may be as little as 1.5 to 2 hours. If you and your clinician decide that this is a good choice, you and your dialysis care partner will be trained on how to do this at home, as Jane had mentioned. Your care partner can be a family member or a friend, but needs to be somebody that's available to you pretty consistently. The training for home hemo at the program that I worked at was about 6 weeks. So it does require, in some centers, a pretty significant amount of time off of work to do this training. Home dialysis can have some advantages over in-center dialysis. It allows you to schedule your treatments to fit into your routine. You can have more independence and control of your own treatments. You may also be able to have the comfort and privacy of being in your own home during treatment. However, home dialysis might not be a good fit for everyone. You'll need to be willing to be responsible for your own treatment. We talked a little bit about infections last week, and with home dialysis, hemo or PD, you are responsible for maintaining a sterile environment. For some people, this responsibility is empowering and can put you back in the driver's seat, but for others, this responsibility may be very overwhelming. So as Jane mentioned, there's a couple different types of home hemodialysis that can be done at home. There's what's called conventional home hemo, where you do it 3 to 4 times a week for 3 or 4 hours or longer each time. The short daily home hemodialysis that I just mentioned, that's done almost daily, maybe about 1.5 to 2 hours each, depending on your prescription. And then some programs offer nocturnal home hemodialysis, which is low and slow flow treatments that are done at night while you're sleeping. You can do this type of dialysis 6 nights a week or every other night, depending on what your prescription is and what your provider suggests. Whether it's home or in-center, hemodialysis treatments may cause people to feel headaches, nausea, cramping, may feel washed out after a treatment. Generally, doing dialysis more often, like in the home modalities, where less fluid is being removed each time, can reduce some of these symptoms. Reports have also indicated that people using short daily and nocturnal home hemo can have fewer and shorter hospital stays and then have a better quality of life. Jane talked about peritoneal dialysis. She mentioned the 2 types of peritoneal dialysis, the continuous ambulatory, where you do the exchanges during the day, and then the automated peritoneal, which is usually done at night. So whichever treatment option you choose, again, as Jane said, it's important to know that you are getting the right amount of dialysis, and that's going to be based off your lab work, based off your diet, based off your fluid intake. But some questions to ask your healthcare team or to consider, and hopefully we'll be able to help you identify this, is what types of dialysis are right for you. If you choose a hemodialysis, is a fistula right for you? Should I do this at home or in a center? If I choose in-home dialysis, which type should I choose? If I have some residual kidney function, how do I preserve that when I start dialysis? So on this slide, we talked a little bit about options and what they look like. And now let's see how these options apply to things that people commonly feel are important. And I've identified a couple on these next 2 slides. It's important to remember that about 20% of people with chronic kidney disease are between the ages of 18 to 64, which is generally considered about working age. Let's talk about work for a minute. Jobs can be fulfilling. They help support the household, they help provide medical insurance and other health benefits, and they can just be socially rewarding. I know that during this pandemic, my job really saved me from the social isolation that I was experiencing outside of work. So how, if you want to, do you keep your job when you learn that you have kidney disease and need to start dialysis? One thing that's important is knowing what you can do at your job when you have kidney disease. Whether it's working in an office, in a factory, a retail store, a warehouse, or working outside, realizing what you can and cannot do at your job is the first step to continue working. Whether you have chronic kidney disease or other chronic health issues, it's important to know what your limitations are. People with kidney disease may experience tiredness or weakness, and may consider the type of job they are performing. You may want to talk to your manager or supervisor about what you can do. Is there anything that needs to be modified for your position? Are there different departments that can be more accommodating to your physical needs? And should you work fewer hours or maybe work on different days? And one way that this can be supported is through documentation from your provider, either through a Family Medical Leave Act paperwork or something through the American Disability Act, the ADA, that requires your employer give you certain concessions to make sure that you can stay employed. For people needing dialysis, they will have to have an access that needs to be protected. Those who do hemo, whether it's in-center or at home, will need a vascular access that goes either in your lower arm, your upper leg, or I'm sorry, your lower or upper arm or your upper leg. If there's physical demands at your job, you're going to want to make sure that the job won't harm your access area. Lots of people call it their lifeline and protect it as such. People on peritoneal dialysis have an abdominal catheter that should also be considered when doing physical labor, such as heavy lifting. Your doctor will give you guidelines as to how much you can lift if you are on peritoneal dialysis. You'll also have to make sure that you have time to see your doctor when you're scheduling your dialysis treatments. If it's an option, perhaps you can work from home on some days or have that flexibility. Many people will take a temporary leave from work when they're first starting dialysis, and that can be either supported through FMLA, which preserves your job but does not pay you, or if your job has short-term disability benefits, you may qualify for those as well. You can also consider using vacation time or paid leave if you wanted to do that, and that temporary leave of absence can be discussed between you and your employer. Things to consider with your treatment options in your work schedule. So if you say you choose nocturnal in-center or nocturnal hemodialysis, this works well for people who have full-time work during the day, and nocturnal dialysis would allow you to dialyze overnight at a dialysis center, which is a great option. One drawback from that option and from even overnight peritoneal dialysis is the time spent away from your home and your family, and the time that you are required to hook up to the machine. So I have worked with a woman who did peritoneal dialysis. She had kind of an active social life, but she was employed full-time, and that was one of her goals. That was what was important to her. And as I got to know her a little bit, we would talk about what she was doing and what she was up to on the weekends. And one of the big stressors in her life was that she would work until 5, and she would have to hook up to her machine by 8 o'clock in the evening to be able to be off of the machine by 6 o'clock in the morning so she could get to work on time. And so that just allowed her 3 hours in the evening on most evenings to engage in any social activities or errands or anything that she wanted to run. Her maintaining her employment was her priority over her social life. And so she understood, you know, that she lost a little bit, but gained a lot of what was important to her. Home hemodialysis is another flexible option because it's performed at home. The daily home dialysis treatments are shorter, and you can do those in the evening, and then, you know, sleep without any connection to a machine at night, which is important for people. It's portable, so you can take it with you if you have to travel for work. Another thing to consider as far as a symptom goes is if you're feeling fatigued or run down, you might be anemic, and that's important to talk to your provider about it. You may have many symptoms of chronic kidney disease and end-stage renal disease that a lot of other people have, but just because you have those symptoms doesn't mean that they can't be treated if it's important to you. One thing that I want to mention, you know, about working, and I worked with a lot of people who really pushed themselves to stay employed because they were very concerned with health insurance for themselves and their family. But if you're in a situation where you only need to be concerned with your own health insurance, end-stage renal disease has a unique benefit where you are automatically qualified for Medicare if you have the work history to support it. So what that means is if you have to start dialysis and you choose to do home dialysis, your Medicare effective date will begin on the first day of your home training. And you will have those Medicare benefits and then an opportunity to purchase a supplement if that's available in your area, and a prescription benefit if that's in your area. But you have access to this insurance even if you can't work. And it's pretty good insurance. It's not free, but it is pretty good insurance. If you are unable to work and you have the work history to support it, you would also qualify for Social Security disability after your 5th full month on dialysis. And that's standard across all dialysis. So there is an income that you can receive if you are unable to work. And for many, unfortunately, your disability income is less than usually your work income, but it is something there that can help you to pay your bills, although it does take a little bit of time to get started. Traveling, some people like to travel. In transplant, when I talk to people about what they're looking forward to doing now that they've had a transplant, one of the first things that many people say is travel. Taking a cruise, going out of the country, going to the beach. And a lot of the people that I work with have done in-center hemodialysis. So they have been more restricted when they're traveling. As Jane mentioned, you can pack up that machine in your car and take your supplies with you and take it on down the road and do dialysis wherever you are, which is a really nice option for people who feel travel is important to them. He's usually at the spring clinical meeting that the Kidney Foundation puts on, and he kind of goes on tours, and he is in an RV, and he does his hemodialysis in his RV, and he'll sit there and just show you how he just hooks up and does his dialysis and travels and just moves on with his life. And so that is something that's really important to him, but it's also important to him to share that experience with other people. There's a pretty big emotional component to doing dialysis at home, and people see it in different ways. And so for some people, having the opportunity to do dialysis at home is very empowering to them. They feel like they're able to regain control of something when they feel that they've lost all control of everything else. And we talked about informed decisions and making choices and understanding that everything you do is a choice. But it can take an emotional toll on you. And so for some people, doing dialysis at home is very empowering, and it puts them back in the driver's seat, as I said. But for some people, it's very overwhelming. For some people, keeping supplies in their home is a constant reminder of their kidney disease. And I have worked with patients who, we would strongly encourage to do home hemo or peritoneal dialysis because their health and wanting to preserve their kidney function and preserve their work, but it was just emotionally too taxing to have that in their home and have their loved one be their caregivers for this medical issue that they really prefer to have somebody else to manage. And so there's no right or wrong answer, but there are things that you have to consider of what would be important to you. You will hear a lot of push about doing dialysis at home. And I do think that for many people, doing dialysis at home is a great and important option to consider. But if dialysis at home isn't for you, and you've heard all the information and you've been able to make an educated choice on that, then that is your choice and that is okay. But I think the most valuable thing that you can hear as you're hearing all this information about dialysis at home, if you ever have to start dialysis, is, knowing what your choices are as far as doing treatment at home. If we could go to the next slide. And so, responsibility and assistance. So, like I said, some people really like the responsibility involved in it. It puts them back in the driver's seat. Maybe you're a manager at work and you like to do this at home. I work with a person who did the continuous ambulatory peritoneal dialysis, and he was a restaurant manager. And so he would work long hours and scoot to his office for about a half an hour, do an exchange, and come back out and move on like nothing had happened. And very few of his coworkers even knew that he was on dialysis. He was a very in control, take control type of person, and he did very well with that. But I've also worked with people who are in supervisory roles that prefer for somebody else to manage something because they think that they're more of an expert in it. As Jane mentioned, your dialysis center will not let you go to do dialysis at home if they don't feel like it is safe for you to do so. Jane talks about what you've seen one Chewies, but I think that universally dialysis centers will not allow you to go home if they don't feel safe that you are able to go home. And so a lot of the staff that work in dialysis centers may not even require prior dialysis experience. And if they can learn how to do dialysis for you, you can certainly learn how to do dialysis for yourself if you're interested. And so that's the other part there, is the assistance. Is some people really like to have someone doing it for them and assist them in it. Your helper or the person that's going to train with you would probably need to take some time off work to complete this training. But if they're a family member or a friend that may qualify for that FMLA leave, they may be able to take that leave and preserve their job if that's a concern for them, you know, taking time off work that they may fear that they're going to lose their job. So that's all I got for you on that. I'm going to hand it over to Melissa.
All right, well, thank you so much. And I feel like my other co-presenters covered so much and such great information in this session today. So when we think about home dialysis, I think the main thing that really sticks out is that home dialysis allows people with advanced kidney disease to be independent and can eat and drink more of what they like. And we've talked through a lot of the different benefits, improved quality of life. You have more flexibility with your schedule and increased independence, maintaining a more active lifestyle, continuing to work or starting to work again, spending more time with friends and family, saving on transportation costs to get to and from the dialysis center, improved blood pressure control from having more frequent dialysis. Some patients have better sleep, reduced nausea and fatigue, reduced risk of infections, fewer hospital visits, and so forth. So if we go to the next slide, we're going to talk first just about home hemodialysis. So some of the pluses with home hemodialysis, and some of these are also the same with home peritoneal dialysis, but more normal diet and fluids. Because dialysis is more frequent, we tend to be able to be a little bit less strict with the diet. And I do have a slide and a few slides talking a little bit more about the diet. So I'll talk a little bit more about that then. But in general, we're able to be a little bit more normal with that. So fluids, we still are watching all of the various parts of the renal diet, but patients are able to enjoy a little bit more because they're getting dialysis a little bit more frequently than they would in center. And then we've talked through about with the home that, you know, it's more work friendly. You're in charge of it. You're not going into a medical facility or treatment facility, so you're less likely to be around people who may be sick or ill, which obviously could be a concern during our current situation. And for some people, they may feel emotionally a little bit better. And then, we've talked earlier in this presentation that it's portable. You can take it with you, fits into your schedule. And another thing is the fistula, which is what you would use for home, can last a little bit longer. And then we talked about some of the things to consider, the storage space for, having the material there. With home, sometimes the partner would be needed. But again, we've talked through, there's a lot of training that goes on, making sure that you are feeling safe and able to continue with, doing the benefit at home. The other thing with home dialysis, and we've talked with this for some medications, but part of it is there's some fewer low blood pressure episodes and then less need for blood pressure medication in some cases. So that is a benefit. So with the more frequent dialysis, we're able to get rid of more of the waste products that your kidneys normally would do. And so patients feel like they have more of an appetite. Sometimes having that buildup of waste products affects our appetite and not wanting to eat as much. And this allows you to have a normal appetite and feel hungry. There's also improved post-dialysis recovery time. So just that time it takes to kind of bounce back and feel energized. And we've talked a lot about going back to work or going to school. And then something else that's come up is, or at least that I've seen when I was looking at some of the benefits here, is that patients who are on a home modality, so if it's home hemodialysis or home peritoneal dialysis, they're more likely to be listed on a kidney transplant list. And so in one article that was probably like 5 years ago, they had reported about 35% of home hemodialysis versus 14% of in-center dialysis patients were listed on a kidney transplant list. And then the improved survival rates in home dialysis in general are a little bit higher with the more frequent dialysis. Next slide, please. So looking at peritoneal dialysis, again, a lot of very similar pluses with that. So we've talked about the diet and fluid, the portability and the work-friendly treatment modality. Again, you're in charge of your treatment. You are taking charge of that. And the same thing with the home hemodialysis. You're not going into a dialysis facility 3 times a week, so you're less likely to be around people who may be sick. You may also feel less ups and downs emotionally. And again, flexible. You can do that wherever, anywhere in the state. It's a needle-free treatment. And again, you would work with a nurse, an educator to really learn how to do that treatment. And similar things to consider with the storage space, some of the limitations with swimming that may be a factor for peritoneal. But with peritoneal, there could be some better preservation of residual renal function. So your kidneys may still work a little bit more than they might on hemodialysis, or at least a little bit longer. Not that there's an improvement in kidney function, but you might still have a little bit of function for a little bit longer. 80% of patients on peritoneal versus about 68% of patients on in-center hemodialysis for 2-year survival rate, so an increase in that. We've talked about that increased control and ownership over your treatments and travel and flexibility, and then greater quality of life. And this is just for home in general, that greater quality of life. And patients on peritoneal dialysis have higher self-reported quality of life scores than standard in-center dialysis patients. And again, quality of life is your self-perceived quality of your life and your health. And then an interesting little statistic was that patients on peritoneal dialysis may be more likely to receive a transplant. Now, it's not because of the modality choice, but if you think about the home hemodialysis, more patients are listed on transplant lists when we're choosing a home modality. Also, peritoneal dialysis is chosen more frequently than home hemodialysis in the United States. So I know Dory was talking about that push for home. So we want to have patients that are able to do home to kind of consider that and evaluate those options. But we want more patients doing home. And so in the United States, peritoneal is more likely chosen than the home. So that's another reason why that transplant may be a little bit higher in patients on peritoneal. And then also thinking about, you're taking better control of your disease, you're really kind of taking that ownership and managing it. So you most likely may have some better outcomes and lab results, and I don't want to say adherence to treatment, but kind of following that treatment prescription in a way that you are someone that would be screened at a transplant center of being eligible to receive a transplant. So again, it's not because someone chose PD that a transplant center is going to say, you're on PD, you're higher in the list. There's a lot of factors that go into it, but it's really more of that overall picture of how well you're taking care of yourself, and that someone on a home modality is more motivated to be listed on a transplant list in a facility. Next slide, please. So this is just on the nutritional management. So some of the things that, you know, we look at with home modalities and peritoneal, because it is often a more frequent dialysis option, we tend to have slightly higher protein needs than someone who's doing 3 times a week in center. So we've talked in previous sessions about when you're not on dialysis, we want to limit the amount of protein that we're eating because that's better for the kidneys. But once you're on a treatment modality like home hemodialysis or peritoneal dialysis or in-center hemodialysis, you have a higher protein intake because we lose a little bit of protein when we do these treatments. So we want to make sure we're replacing the things that we lose during treatment. You also lose some water-soluble vitamins. And so a lot of times patients might be on a renal-specific or kidney-specific vitamin as well. We still are always limiting our high phosphorus foods, no matter what stage you're at in kidney disease. Phosphorus is probably one of the #1 foods that we're always looking at and really working to manage. And we've talked before about how frequent phosphorus additives are in our food supply, and that, you know, they're 90 to 100% absorbed, and it's hard for patients to really control that phosphorus when we're not producing a lot of urine to eliminate that from our body. And dialysis itself is not best management of phosphorus management. So we continue to really manage phosphorus heavily through diet, medication, and then also the dialysis treatment helps a little bit, but it's just not as great of a clearance for phosphorus. But so we still limit that, but you might have some more normal levels with phosphorus without having to take medication. So we can, you know, kind of normalize your diet a little bit, but always focusing on those phosphorus additives and really going for cooking at home as much as we can, kind of the whole minimally processed foods. And then flexibility with potassium. This is really big for patients because we know potassium, obviously we want more protein, and we have a lot of potassium in our protein-rich foods. We need to make sure that we're eating our protein-rich foods, but it's also good in our fruits and vegetables, and we want to make sure that we're eating healthy amounts of those as well, and high fiber foods. So having that flexibility with potassium is really huge. You know, you might want to have some spaghetti with red sauce, and so you'll more likely be able to enjoy that doing a home treatment modality than in center. And for some patients that I've worked with on peritoneal dialysis, we've actually had low potassium levels, so we want them and encourage patients to eat more potassium so we can actually get some of those levels up, or sometimes they're on a potassium supplement. And then we're always going to monitor fluids and sodium just in general. So we always want to make sure that we're monitoring that. But you often can be a little bit more flexible with it if you are having more frequent dialysis, because it's working a little bit more like your regular kidney would. If you think about it, your kidneys are working 24 hours a day, 7 days a week. And with a dialysis treatment modality, it's that external kidney that's doing the job of your kidneys. So if you're on 3 times a week in center, that 24 hours a day, 7 days a week goes down to on average 12 hours a week, 3 times a week, you know, total. So like 4 is kind of the general treatment time for each treatment. So it's a much lower amount of external kidney function. So more frequent dialysis can really kind of help with clearing excess fluids and sodium. But we still want to be careful. I actually was talking with the peritoneal dialysis patient earlier today because they had gained about 4 pounds over the weekend, and the you know, the healthcare team was just a little bit concerned about that. So kind of reviewing besides just water and beverages, that there's other things that count as fluid, like popsicles and ice, anything that melts. So we're always kind of focusing on that, but you do have a little more flexibility with that. And so, and I think just to kind of wrap up, so just sort of thinking about the treatment that fits your lifestyle. And, you know, I know Dory was talking about this, but these are just kind of questions to ask yourself. And how will your treatment affect your daily routine? So will your work schedule or home responsibilities have to change to accommodate your dialysis treatment? Do you want to be in control of your treatment with better understanding of the dialysis process, or do you want someone to do it for you? How far will you have to travel to a dialysis facility? Do you want to visit the dialysis facility 1 or 2 times per month or 3 times a week? So just questions to kind of start thinking about and asking yourself, especially as we go into next week and discuss in-center hemodialysis about what is the best for you. And with that, I think we have time for questions.
All right, thank you, Melissa. Yeah, like you said, let's see if anybody has any questions. I'll remind you again, if you're not comfortable unmuting yourself and just speaking up, you're welcome to type things into the chat feature. But either way, ask away. I'm sure people have some questions out there.
Hi.
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 We, no one's on dialysis here yet, but we're taking all this information in. We were just wondering about the travel. Can you actually get on an airplane? Let's say there was no COVID issue. Can you get on an airplane with all that equipment, like on one system over the other, or do you have to drive?
You can fly. I'll let Jane take more of it, but you can fly, you can take cruises, and there's different paperwork that providers can fill out to keep those supplies with you so they're not checked under the plane. But I'm sure Jane knows more about that than.
You know, a lot of it depends. I had a patient who did peritoneal dialysis across France. She was a school teacher and she took groups to France every summer. That's kind of a little more extreme. If you're doing peritoneal dialysis, it's a lot easier. If you're going to be gone someplace, say for 2 weeks, you can have your supplies delivered there. The hemodialysis machine weighs about 70 pounds. Now, my understanding is that if you are traveling, you may have to consider it gate checked, but the example of that is my daughter-in-law's parents gate checked her mom's wheelchair in Albany. They came to Birmingham, the wheelchair took a side trip to Cincinnati. So I think that's always kind of risky, but yes, you can travel. Now, for hemo, it may mean that you would have to dialyze in center, which can be done. And, you know, places like, say, Disney World down in Orlando, they have a dialysis unit there that is only for visitors. I'm sure they're closed now, thanks to COVID. But yes, you can travel. It takes some arranging, but yes, you can travel. With whatever.
Often you'll be set up with or given resources about a local dialysis center that you can be connected to if you need to troubleshoot it all. I did have a woman who went on a cruise and all of her stuff was delivered shipside and taken to her room, and she did dialysis. She did the peritoneal dialysis on the cruise. One barrier for especially international travel is insurance coverage. And so, for instance, if you're using the Medicare benefit, they won't pay for dialysis outside of the United States. Other private insurances may have more flexibility in that, but that is one barrier that some of my patients encountered. And whether it was in-center dialysis or home dialysis, they may not pay for those supplies to be shipped overseas, but you may be able to take them with you and get around it that way.
Well, that's what my patient did, was she took the supplies with her, and the kids in her class carried them.
And my mom was on peritoneal dialysis. And so every time she traveled, she would either, it depended on how long she would go or be on vacation. Sometimes she would take her items with her, especially if she drove. But if she flew, she would, call. Sometimes she would just call and make arrangements so that she can do in-center when she would get there.
frequently, it can be done. It's another step when you're traveling, but, it becomes a part of your life.
Thank you. It's really helpful.
Does anybody have any other questions?
And I want y'all to know, I don't even like Chewies. I just like the sign. But there are some commonalities, and one, as was pointed out, is nobody cuts you loose till you were trained. And I had a patient who, they were real country. He came into the hospital. He was quite ill. The wife had never ridden in an elevator, and they were grown, older. They're older than I was. She had never ridden in an elevator. She got scared to death in the cafeteria because she didn't understand how that worked. So when I say they were deep country, they were deep country. In addition, they could not read or write. They did peritoneal dialysis for years and were very successful. He ended up dying of pancreatic cancer, but dialyzed till the end.
Yes, and my mom, she was on, she went in center. She started out going to a dialysis center at first, and then she switched over to peritoneal dialysis. And she said she loved peritoneal dialysis because she was in control. She could set her own hours, so she loved it. So, yeah.
My husband's grandmother was on peritoneal dialysis for as long as she could be, and then she had to go to in-center hemo, but she had everything set up in her room. She had a coffee pot in her room, and his family is notorious for being night owls, so she had the TV in her room, and she would just sit in her chair and do her dialysis. And I think the important part to remember about when you talk about a nocturnal treatment, whether it's an overnight peritoneal or a nocturnal hemo, is that you don't actually have to be sleeping. The tubing that you have will be long enough that you can move around your house, you can go to the bathroom, you won't go to your mailbox, but you're not confined to, one small space during that treatment. So the treatment doesn't have to be only when you're sleeping, so your bedtime doesn't move up, but you do need to be able to have access to be connected to that machine for the time frame that the provider prescribes for you.
Very good. Are there any other questions or any other comments?
I would just like to say, if you think you would be interested in a home modality, go to a home training unit, see the equipment, pick it up, talk to patients. All that we're telling you is, we're barely skimming the surface. You have to really get down to the nitty-gritty.
And I think it's important to talk to people that have success in it and that haven't had success in it. Because you will encounter both sides of it depending on where you are. If you go to an in-center unit, you may talk to people that thought home dialysis was terrible because it didn't work for them. And if you go to a home training unit, you may talk to people that think in-center is terrible because it didn't work for them. But I think it's really important to get that patient perspective from both sides. What was good, what was bad, because these are all options. If we had the option, we wouldn't even be considering this. But these are options that we have right now, and some work better and some don't work as well for us. And patients, I think when it comes to dialysis options in center or home, are the ones that can really give you that unique perspective as to what you should really look out for.
And don't listen to your neighbor who says if you go on peritoneal or home, you'll get an infection and part of your body will rot off. Don't listen.
Thank you.
Thank you so much.
Well, I really hope that the presentation was helpful for everybody, and I want to remind you that we have one more episode in this series. I encourage you to join us again next Wednesday at the same time. We'll be learning about in-center dialysis. And I also want to let you know that the National Kidney Foundation has a toll-free call-in center. The number is 855-NKF-CARES. It's as in National Kidney Foundation CARES, C-A-R-E-S. And you can call them anytime, and any questions that you have, they will either answer your question or they'll get an answer for your question.
April Peralta.
I'm sorry?
Joined the meeting.
Oh, I'm sorry. I thought somebody was chiming in. Anyway, I want to thank Dory, Melissa, and Jane for lending their expertise and being so generous with their time on these sessions. It's so helpful. And I also like to say thanks to Telegen for their support on this program. Now, on behalf of the National Kidney Foundation, as always, I'd like to wish you all good health. I hope that you have a great rest of the week, and I hope that we see you next week.
Thank you.